All right, you're getting ready to enroll into Original Medicare and you need to sign up. Original Medicare enrollment scenarios. There's really 3 scenarios and I urge you to identify which one that you fall into. Scenario 1, you're currently receiving Social Security benefits. This is the easiest one. Scenario 2, you're not receiving Social Security benefits. And Scenario 3, you're working. Each one requires a very specific set of circumstances. Scenario 1, like I said, this is the easiest one. If you are currently drawing Social Security when you turn 65, you are automatically going to be enrolled into Original Medicare. And you're going to get that ID card. It's going to come in the mail roughly 3 to 4 months before you turn 65. And then your Part B premium of $202.90 is going to be taken out of your Social Security check automatically. Scenario 2, this one is a little bit different here. So if you fall into Scenario 2 and you're not receiving Social Security benefits and you want to enroll into Medicare, you can do this a couple of different ways. We can obviously help you, or you can enroll online, over the phone, in person, or mailing. If you go in person, you're going to want to go to your local Social Security office. If you're mailing, you're going to want to mail it to your local security office. And then if you call over the phone, here's the number 1-800-772-1213, or you can go online at ssa.gov/benefits/Medicare. Scenario 3, if you're still working and covered under employer plan. This one, I believe, is one of the most complicated options in deciding what's right for you when enrolling on Medicare. What we do, we're going to ask you to really compare your current employer plan with your Medicare options side by side. And that's exactly what we're going to do. We're going to put option A here, option B here, and we're going to find out what is best for you. So to summarize that, Scenario 3 is a little bit more of an individualized conversation that we would be happy to help you with. So many people think Original Medicare covers everything, and that could not be any farther from the truth. Main thing you need to know is Medicare Part A, which is hospital coverage. They're going to leave you with a $1,736 deductible on day 1. If you have a longer hospital stay, you may have a daily copay here in 2026. Part B, also known as your doctor coverage. There's going to be a deductible there. The deductible here in 2026 is $283. And then you have a 20% coinsurance with no limit. So if you have Original Medicare, nothing else, you've got some bigger exposures that we need to be aware of. When it comes to Original Medicare, a lot of people say, okay, Chase, I get it. Original Medicare doesn't cover everything. What can I do to eliminate exposures? Well, the 2 common solutions here are going to be Medicare Supplements or Medicare Advantage plans. And let's do a quick deep dive on both of those. When it comes to Original Medicare, you have Part A and B, hospital and doctor coverage. The solution that's been around the longest would be a Medicare Supplement and a Part D prescription plan, also known as Medigap. So Part A, Part B, and then you'd add a Medicare Supplement, commonly known as Plan G or Plan N, and then a prescription drug plan. That is Original Medicare. That is going to be your most robust and comprehensive coverage. The other option would be Medicare Advantage plans. This is also known as Part C. They must provide the same basic benefits of Part A and B, but you are leaving Medicare and going on to a private insurance plan. These private insurance plans are managed care plans, and they often have a Part D prescription drug plan. Now, when it comes to Medicare Advantage plans, very unique conversation. We're going to look at your individual needs. We're going to look at your individual doctor's medications and make sure we find the right plan for you. Okay, when it comes to comparing Medicare Supplements and Medicare Advantage plans, it's pretty simple when you put them side by side, and we're going to break them down very quickly for you here. Medicare Supplements, you're going to need to pay your Part B premium. That Part B premium in 2026 is $202.90. It is very hard to get away from that Part B premium unless you have a special qualifying event that we can kind of identify and help you through there. Coverage. This coverage is often going to be the lowest out of pocket, the most robust coverage when it comes to Medicare. Networks, you can choose any doctor that accepts Medicare. And then Part D plans, typically you're going to add a Part D plan with your Medicare Supplement plan. When it comes to Medicare Advantage plans, these are quite a bit different. Okay, Medicare Advantage plans, the one thing that is the same, you're still going to pay that Part B premium of $202.90. The main difference here is the coverage. You're going to have more out-of-pocket responsibilities. So typically you're going to have higher out-of-pocket responsibilities when seeing doctors in hospitals. That can include max out-of-pockets, co-pays, co-insurance, and network restrictions. So you must choose a specific doctor that's contracted with that plan in order to receive the best coverage. Nice thing is Part D is typically included in these plans, and then there are some extra benefits that can include dental, vision, gym, over-the-counter benefits when choosing these plans. So let's put them side by side. If I had 60 seconds to explain the differences between a Medicare Supplement and a Medicare Advantage plan, here's exactly how I'd do it. No matter what, it doesn't matter which plan you go with, you're gonna pay a Part B premium. That Part B premium in 2026 is $202.90. With a Medicare Supplement, you're going to have an additional premium here. You're going to pay an additional cost. Medicare Advantage plans, a lot of times, those can be $0 plans. Now with $0 plans, often you're gonna have higher out-of-pocket costs. With this plan, you're paying a premium, you're gonna have lower out-of-pocket costs. So you're paying what you get what you pay for, right, is what it comes down to. You pay more, you pay less, you get less coverage. Networks, you get a really expansive network. Anybody that's gonna take Medicare is gonna accept this Medicare Supplement plan. Over here on the Medicare Advantage plan, you need to choose specific doctors and hospitals when contracted with these plans. Lastly, Part D, that would be an optional plan with Medicare Supplements. Medicare Advantages typically include the Part D, and they have extra benefits. So after recapping Medicare Advantage plans, Medicare Supplement plans, the common misconception is if I get a Medicare plan, I'm in good shape. And I want to make sure as we tackle that myth here, one of the biggest exposures that you need to know about is that no matter what, if you have a Medicare plan and you have a cancer, a heart attack, or a stroke diagnosis, you're going to have other expenses that Medicare doesn't cover. We see them all the time. The common question I get is, Chase, what expenses? Big one's going to be medications. Typically when you're diagnosed with a cancer, a heart attack, a stroke, you're going to be put on medications. Even with a cap on your Medicare Part D plan, you are going to have out-of-pocket costs. Extremely important to know that. Second thing I want to make sure you're aware of is when it comes to Medicare Advantage, Medicare Supplements, one of the biggest expenses that you will have that no one ever talks about is going to be skilled nursing coverage. Now, what I really want you to know here is after day 100, you are responsible for all costs. There is nothing at all that Medicare covers after 100 days. And critical that we know that. Average cost right now ranging around $10,000 a month. If you don't have a plan after 100 days, Medicare is not going to cover you.